Imagine if I told you that 3 days before a stroke strikes, your heart is already sending out a warning signal. It's a signal so specific and unmistakable that if you know what to look for, you could stop a stroke before it ever happens. And what if I told you that the majority of people over 60 who suffer strokes experience these exact warning signs in the days leading up to it, but they either ignored them or simply did not know what they meant? My name is Dr. Eduardo Perez Alba. In my years of studying cardiovascular and neurological health, I have seen this exact pattern repeat itself more times than I can count. I've met with patients who came to me after surviving a stroke, as well as family members of those who tragically did not make it. When we sat down and walked back through the days right before it happened, the warning signs were consistently present. They were undeniably there. The heart was communicating, the body was practically screaming, and nobody was listening. That changes today, because over the next 20+ minutes, I'm going to guide you through everything your heart is trying to tell you during those critical 3 days before a stroke. We will cover the physical indicators, the neurological signs, and the noticeable shifts in your sleep, vision, speech, balance, and even your emotional state. I am going to explain precisely why these symptoms occur, what is unfolding deep inside your body when they happen, and the exact steps you need to take the very moment you spot any of them. Make sure you watch this entire video all the way through, because every single section builds directly on the last, and the details in the second half are every bit as critical as what I share in these first few minutes. So please, stick with me. This could easily be the most vital video you ever watch for your own well-being or for someone you love. Let me start by making sure you truly understand what a stroke actually is. Most people only have a broad, hazy concept of it. They know it is something serious that happens inside the brain, and they know it can be fatal or cause lasting paralysis, but they don't really understand the underlying mechanism. Once you comprehend that mechanism, all of these warning signs start making complete, logical sense. A stroke occurs when blood supply to a section of your brain is either cut off by a blockage or when a blood vessel within the brain bursts open. The moment brain cells stop receiving oxygen-rich blood, they begin dying off within a matter of minutes. In fact, in just 4 to 6 minutes, billions of vital neurons can suffer permanent, irreversible destruction. The two primary forms are ischemic stroke, which accounts for roughly 87% of all cases and is caused by a blood clot obstructing an artery in the brain, and hemorrhagic stroke, which happens when a weakened blood vessel ruptures and leaks directly into surrounding brain tissue. Now, here is what most people completely overlook. The vast majority of strokes do not simply strike out of the blue. They are actually preceded by a stretch of cardiovascular instability, arterial pressure, and neurological disturbance that can last for several days. Your body is far from silent during this period. It is being loud. It is frantically attempting to adapt and compensate for the failure developing beneath the surface. As it tries to adjust, it broadcasts clear physical, sensory, emotional, and behavioral signals that, if you recognize them, give you a crucial window of opportunity to step in, seek emergency medical help, and potentially save your life or the life of a loved one. I want to focus specifically on the role of the heart, because people frequently treat heart health and stroke risk as completely separate issues, and that is a dangerous misunderstanding. Your heart and your brain maintain continuous, real-time communication through the circulatory system. Whatever is taking place inside your heart directly impacts the volume and quality of blood flow reaching your brain tissue. Whenever your heart comes under strain, when its rhythm falters, when its pumping capacity declines, or when microscopic clots begin forming inside its chambers, your brain is the very first organ to suffer the fallout. One of the most significant cardiovascular risk factors for a stroke is a condition known as atrial fibrillation, commonly referred to as AFib. In AFib, the upper chambers of the heart quiver and beat chaotically and irregularly, rather than contracting in a steady, synchronized rhythm. That irregular, turbulent motion causes blood to pool and sit still inside the heart's chambers, and stagnant blood quickly forms clots. Those clots can then break loose, travel from the heart up through the carotid arteries, and lodge directly in the brain, choking off circulation and triggering an ischemic stroke. What makes AFib particularly treacherous is that it frequently comes and goes intermittently. It might last for brief minutes or several hours at a time without causing any obvious, dramatic warning signs. Millions of adults over 60 live with AFib without having any clue they have it. They might experience an occasional flutter, a subtle sensation in their chest, or absolutely nothing at all. Yet in the 3 days preceding a stroke, AFib episodes regularly become noticeably more frequent, last longer, and feel much more intense. So, one of the very first warning signs your heart provides in those 72 hours is a shift in its baseline rhythm. And if you know how to spot that change, you hold an early advantage that most people miss entirely. In the 3 days leading up to a stroke, many individuals begin noticing a very distinct form of fatigue. This is not typical tiredness caused by a hectic day or a poor night of sleep. It is a deep, heavy, cellular level of exhaustion. It is the type of fatigue where your physical body feels as though it is grinding away just to sustain basic daily functions. Because it literally is. When your cardiovascular system is straining and blood delivery is falling short, your body reallocates vital energy away from non-essential tasks to keep critical organs functioning. Your muscle tissue receives less oxygen, cellular energy production plummets, and the end result is a profound, unexplainable sense of complete exhaustion. Many stroke survivors describe this sensation in the days prior as a crushing heaviness unlike anything they had ever experienced before. It is an overwhelming tiredness that makes no sense given how much rest they had gotten. Others describe it as trying to move through thick, heavy air or deep water, where even the smallest daily task requires enormous physical effort. This isn't laziness, and it isn't just a low mood. This is your physical body actively diverting vital resources to manage a building cardiovascular crisis right under the surface. Right alongside this profound fatigue, many individuals develop a very specific type of headache in the days leading up to a stroke. This pain stands apart from standard tension headaches or typical migraines. It usually concentrates near the base of the skull at the back of the head, presenting with an intense pressure quality, like something is squeezing or throbbing from the inside out. In hemorrhagic strokes, the headache that hits at the exact moment of rupture is famously remembered as the worst headache of someone's life, a sudden, violent thunderclap of absolute agony. But in the days prior, the headaches are often subtler and progressively worsening. They may fluctuate, feel sharper upon waking, or arrive paired with neck stiffness and light sensitivity. These pre-stroke headaches stem directly from surging vascular pressure and localized inflammation developing within the arterial pathways supplying the brain. Whenever you experience a headache that feels noticeably different from your regular pattern, especially if it sits at the base of the skull, steadily escalates over several days, or arrives alongside other subtle neurological shifts, that is a critical signal that warrants immediate emergency medical evaluation. Now, let me highlight one of the most underappreciated pre-stroke warning signs of all, which is particularly vital for adults over 60 because it gets dismissed so easily. In the days before a stroke occurs, many people experience sudden, brief episodes of altered eyesight. These visual changes can manifest in several ways. Some describe a temporary dimming or blurring in one eye, almost like a dark curtain briefly being drawn across part of their visual field. Others report seeing flickering flashes of light, strange geometric shapes, or an abrupt inability to focus visually. Some experience double vision for several seconds that then clears right back up on its own. And because these fleeting episodes might only last a few seconds or minutes, people routinely brush them off. They chalk it up to eye strain, assume they need a stronger prescription, or convince themselves it was just a strange, harmless fluke. But these visual disturbances are not eye problems. They are brain problems. They indicate that arterial blood flow to the visual cortex, or the blood vessels feeding the eyes, is being temporarily disrupted. Short-lived disruptions in cerebral blood flow like this are technically known as transient ischemic attacks, or TIAs, often referred to as mini-strokes. A TIA is never a minor incident. A TIA is effectively a full dress rehearsal for a major stroke. Medical research confirms that the risk of suffering a full-blown stroke in the days right after a TIA jumps to between 10 and 15%. with the absolute highest danger zone occurring within the first 48 hours. So if you or anyone close to you experiences any sudden visual shift, even if your vision returns completely to normal within minutes, treat it as a top-level medical emergency. Do not wait around, do not wait to see if it happens again, and go straight to the nearest emergency room or call 911 immediately. Closely linked to these vision disruptions, and often occurring around the same time, are sudden bouts of dizziness, unsteadiness, or a sensation that your surroundings are spinning. The clinical term for this sensation is vertigo, and it carries very distinct traits that set it apart from basic lightheadedness caused by standing up too fast. Pre-stroke vertigo strikes suddenly and without warning. It is often accompanied by nausea or vomiting, does not fade when you sit or lie down, and frequently causes difficulty walking in a straight line, a tendency to veer to one side, or an abrupt loss of motor coordination. This specific form of dizziness points directly to impaired circulation in the cerebellum, the brain region governing balance and movement, or the brain stem, which serves as the primary communication bridge between your brain and physical body. When the cerebellum or brainstem is starved of sufficient blood flow, your balance crumbles, motor control breaks down, and the world suddenly feels completely unstable. If this happens to you, especially alongside any other warning signs we're covering, please treat it as an immediate medical crisis. Now, I want to dedicate some time to what I consider one of the most critical, yet routinely overlooked pre-stroke signals: major sleep disruption. In the 72 hours before a stroke hits, an individual's sleep architecture and quality often shift dramatically. This is far more than basic restless insomnia. Patients report waking up repeatedly throughout the night, feeling their heart racing or fluttering upon waking, experiencing unusually vivid nightmares, sweating heavily in bed, and waking up feeling vastly more fatigued than when they first fell asleep. Some people begin snoring much more heavily than usual, or their partners notice brief pauses where they stop breathing altogether during sleep. This pattern of fractured rest points to multiple internal physiological stressors happening all at once. Your central nervous system is operating on high alert as the body fights to keep blood circulation steady. Stress markers like cortisol and adrenaline surge. And if your brain experiences brief drops in oxygen delivery while you sleep, it triggers emergency survival responses that yank you out of deep rest before your body can complete a restorative sleep cycle. Sleep apnea, which is exceptionally widespread among adults past age 60, exponentially raises your overall stroke threat. A sudden, sharp escalation in sleep apnea symptoms in the days right before a stroke is a trend I have observed time and time again. If your sleep patterns alter abruptly and severely without a clear explanation, if you are waking up constantly, sensing a racing heart at night, or feeling unusually breathless in bed, I urge you to take those signs very seriously. Next, let's address something people almost never connect to stroke risk: sudden shifts in mood, emotional balance, and cognitive clarity. In the days leading up to a stroke event, many individuals become noticeably more anxious, unusually short-tempered, or emotionally volatile. They might express an unexplainable sense of foreboding or impending doom, a quiet intuition that something is deeply wrong without being able to identify why. They may get easily confused by routine tasks that are normally simple, struggle to concentrate, lose the thread of simple conversations, or make minor errors they would usually avoid. These cognitive and psychological changes occur because the brain, even before a full stroke takes place, is already enduring intermittent reductions in localized blood flow. The frontal cortex, which manages reasoning, emotional control, and executive processing, is uniquely sensitive to these vascular shifts. Individuals going through these subtle signs rarely speak up because they don't associate mood swings with cardiovascular danger. They assume they are just stressed, overworked, or having a bad day. Family members and loved ones, please stay alert to sudden, unexplained behavioral or mental shifts in those you care for, as this can be one of the earliest and most telling signs of a developing stroke emergency. One of the most classic warning signs of an impending stroke, and one that people recognize by name yet frequently downplay, is a TIA, or mini-stroke. I touched on this earlier, But we need to go deeper because understanding TIAs is absolutely vital for saving lives. A transient ischemic attack generates classic stroke symptoms that vanish entirely within 24 hours, and very often within just a few minutes. An individual might suddenly lose the ability to speak clearly, knowing exactly what they want to communicate, but emitting garbled speech or drawing a complete blank on words. They might feel sudden weakness or numbness down one arm, one leg, or across one side of their face, struggle to comprehend spoken language, or lose vision in one eye. And then, within a matter of minutes or hours, every single one of these alarming symptoms completely vanishes. Herein lies the real tragedy. Because the symptoms clear up, people convince themselves that nothing serious happened. They rationalize that they were just overtired, that they drank too much caffeine, or that it was simply a strange passing blip, and so they avoid seeking medical care. Then, the full-blown stroke strikes, sometimes hours later, the next morning, or 2 days down the road. If you or anyone near you shows any sudden neurological sign for even 60 seconds, even if it fully resolves, please go to the emergency room immediately. A TIA is a 5-alarm emergency inside your body. It is your final clear warning before a major catastrophe. Now, let's look directly at the physical symptoms that manifest in the heart itself, the ones felt right in the chest and throughout the body, because these represent critical pre-stroke signals that rarely get mentioned in stroke prevention discussions. In those 3 days leading up to an event, particularly for individuals with underlying AFib or heart disease, the heart often begins behaving in distinctly unusual ways. You may feel heart palpitations, a fluttering, racing, or pounding sensation in your chest that comes in waves. You might sense your heart skipping beats, marked by a sudden pause followed by a forceful thump. You may experience persistent pressure or tightness in the chest that doesn't quite match a classic heart attack, but remains uncomfortable and constant. Some people describe a sudden, heightened awareness of their own pulse, as if their heart is suddenly beating loudly in their consciousness. These physical sensations stem directly from cardiac rhythm disruptions and the heightened workload placed on a struggling cardiovascular system. They are explicit warning calls from your heart that its electrical and mechanical functions are straining under stress. If you experience palpitations, an irregular heart rhythm, chest pressure, or an unusual awareness of your heartbeat alongside any other signs on this list, seek emergency medical attention immediately. Do not wait for symptoms to intensify. In the pre-stroke window, time is absolute everything. Another vital signal I must address is a sudden, unexplained spike in blood pressure. Many adults over 60 live with hypertension and manage it daily with medication. But in the 3 days preceding a stroke, blood pressure can surge dramatically, sometimes reaching levels far higher than what someone typically experiences, even with poorly controlled hypertension. This occurs because as the arterial pathways supplying your brain narrow or face blockages, your body automatically drives up systemic blood pressure in a desperate bid to force blood past the bottleneck and keep brain tissue oxygenated. This compensatory pressure rise is your body's emergency attempt to safeguard the brain. However, it carries extreme danger because severely elevated blood pressure can rupture fragile arterial walls and trigger a hemorrhagic stroke. If you check your blood pressure and notice it is significantly higher than your personal baseline, particularly if it climbs above 180 systolic or 120 diastolic, and especially if paired with any other warning signs we've covered, treat it as an immediate medical emergency. Do not simply swallow an extra blood pressure pill and wait around to see if it comes down. Call emergency services right away. I also want to highlight a warning sign that is very frequently missed in women and older adults. Sudden, unexplained nausea and vomiting with no clear gastrointestinal trigger. In the hours or days leading up to a stroke, some individuals experience abrupt waves of intense nausea, with or without actual vomiting. This discomfort has zero connection to dietary choices. It typically comes in waves, often accompanied by cold sweats or dizziness, leading many to assume they simply caught a stomach bug or ate bad food. However, This nausea often stems from rising intracranial pressure building inside the skull as cerebral circulation shifts, or from the vagus nerve reacting to acute cardiovascular strain. The vagus nerve creates a direct link between your brainstem and digestive system. And when the brain endures vascular stress, vagal activation can produce intense nausea. If you experience sudden, unexplained nausea, especially alongside dizziness, headaches, or neurological changes, do not simply blame it on your stomach. Now let's explore what is physically occurring inside your arteries and blood vessels during the days before a stroke, because understanding this process gives you an even deeper appreciation for why your body transmits these signals. In most ischemic strokes, the sequence leading to total vascular occlusion actually develops over several days or longer. Atherosclerotic plaques, the deposits of cholesterol, calcium, and inflammatory matter lining arterial walls, can become structurally unstable. When a plaque destabilizes, its outer fibrous cap can crack or rupture, prompting the body to rapidly dispatch platelets and clotting factors to the site to seal the rupture. This cascade forms a localized clot, known as a thrombus, directly on the surface of the plaque. If this thrombus grows large enough to completely seal off the artery, a major stroke occurs. But prior to total occlusion, before the full stroke takes place, microscopic fragments of that clot can break loose and travel downstream into narrower blood vessels in the brain. These floating fragments are what trigger the brief, temporary symptoms of a TIA. The clot hasn't completely closed the pathway yet, but the destructive process is actively underway, and unless it is interrupted medically, it will almost certainly reach its catastrophic conclusion. This is the vital window, the precise moment when a stroke can still be prevented, and identifying that window depends entirely on recognizing the warning signs I am describing to you right now. Now let's discuss the critical role that blood pressure prescriptions and other cardiac medications play during this pre-stroke phase, as this is a topic many of my patients and viewers ask about. If you are currently prescribed blood pressure medication or blood thinners, it is vital that you adhere to your regimen strictly and never skip doses, especially during days when you might be experiencing any of the warning signs we've discussed. Skipping even a single dose of antihypertensive medication can trigger a dangerous rebound spike in blood pressure that sharply elevates stroke risk. Likewise, stopping a prescribed blood thinner without direct physician guidance allows clots to develop that otherwise would have been prevented. I have encountered patients who felt generally unwell, experienced some of these subtle pre-stroke signs, and made the mistake of skipping their daily meds because they felt too sick or exhausted. Please, never make that mistake. If you are dealing with unpleasant side effects from your prescriptions, call your physician, but do not make the risky choice to halt them on your own, especially when your body is already displaying signs of cardiovascular distress. Let's now examine the key stroke risk factors specifically affecting adults over 60, because your risk profile shifts significantly with age, and understanding your personal risk level is one of the most empowering steps you can take for your long-term health. Past age 55, every passing decade approximately doubles your risk of experiencing a stroke. The primary risk factors that compound in older adults begin with hypertension, or chronic high blood pressure, which affects more than 70% of individuals past age 65. Then there is atrial fibrillation, which impacts nearly 9% of adults over 65 and becomes more common with each decade. Diabetes, which accelerates arterial hardening and damages blood vessels. Elevated LDL, cholesterol paired with low HDL. A history of smoking, physical inactivity, obesity, sleep apnea, and any previous history of TIA or stroke. If you carry 3 or more of these risk factors, your lifetime stroke risk is substantial. And the warning signs I've detailed today are not theoretical concepts. They represent life-saving knowledge you should memorize and share with your loved ones. Now, let's review the exact steps you should take immediately after watching this video. First, I want you to master the FAST acronym, because despite how well known it is, surveys consistently show that the majority of adults cannot accurately identify all 4 components. F stands for face drooping, sudden numbness or weakness on one side of the face, or one side sagging when trying to smile. A stands for arm weakness, sudden loss of strength or numbness in one arm, or one arm drifting downward when raising both. S stands for speech difficulty, sudden slurring, difficulty retrieving basic words, or trouble comprehending spoken language. T stands for time to call 911. The moment you recognize any of these signs, dial emergency services immediately. However, I want to expand beyond FAST because clinical research reveals that FAST alone misses roughly 14% of strokes that present with atypical symptoms. That is why we use the expanded acronym BFAST. B stands for balance and E stands for eyes. If someone suddenly loses their physical balance without explanation or experiences sudden visual changes in one or both eyes, these represent critical stroke warning signs that demand an immediate emergency response. Let's quickly summarize everything we have covered today, because I want these critical warnings firmly etched in your memory. In the 3 days before a stroke, your body may give you any combination of the following signals: profound, unexplained fatigue that differs from ordinary tiredness, unusual headaches, particularly centered at the base of the skull, fleeting vision shifts in one or both eyes, such as dimming, blurring, or partial vision loss, sudden vertigo or loss of balance that does not resolve with rest, and dramatic sleep disruptions, including nighttime palpitations, cold sweats, and waking up completely unrested. You may also notice sudden shifts in emotional state or mental clarity, including abrupt confusion, uncharacteristic irritability, or a lingering sense of foreboding. Brief TIA episodes whose symptoms clear up on their own, such as slurred speech, arm weakness, facial drooping, or vision loss, even if lasting just a couple of minutes. Cardiac symptoms like palpitations, irregular heart rhythms, chest pressure, or a sudden hyper-awareness of your pulse. Sharp blood pressure spikes far above your normal range, and sudden, unexplained nausea paired with dizziness or sweating. Any one of these symptoms on its own might not definitively mean a stroke is coming, but experiencing 2 or more of these signs together, or within the same short time frame, forms a dangerous pattern that demands urgent medical evaluation. Please do not wait. Please do not minimize the symptoms. Please take immediate action. I am Dr. Eduardo Perez Alba, and this is my passion: taking complex, often terrifying medical topics and breaking them down into clear, honest, and actionable guidance. If this video offered you value, taught you something new, or changed the way you think about your own health or the health of someone you love, please share it. Send it in your family group chat, forward it to a friend over 60, or post it on social media. Somewhere out there right now, someone's body is broadcasting these exact warning signs, and they have no idea what those signals mean. Sharing this video could reach them before it is too late. Subscribe to Leonid Kim Health if you want to continue receiving this type of straightforward, comprehensive health education. I regularly publish videos on the topics that matter most to adults over 60. The crucial details your doctor may not have time to fully explain, and the things mainstream media often misses. I will see you in the next video. Take great care of your heart and take care of your brain.